for your time this afternoon on The Upside. A very important, very sensitive conversation, this. Let's start off by understanding the work that you do as a clinical psychologist and the types of patients that you get to interact with on a daily basis.
Thank you for having me. Yes, the work that we do is to support individuals, families with mental health related issues. We assess, we diagnose, we treat individuals with mental, emotional, and behavioral disorders through different means, through psychotherapy or psychological testing. So specifically with me, because every psychologist has their own niche that they work with. So I do work with individuals with mood-related disorders. So that is your major depression, your major depression disorders, your bipolar mood disorders. Then you have your anxiety disorders, which is anxiety and panic attacks. Then I also do work with your psychotic-related disorders like your schizophrenia disorders and also personality disorders. That's your narcissistic personality disorders, borderline personality disorders, your schizoid personality disorders. And then I also work with families, I work with individuals, I also work with children.
You work in a space that I'm particularly very passionate about because depression is a very serious issue, Deborah. And I think there's a lot of misconceptions around depression. Like people think that it's a feeling. They think that it's a feeling that you can snap out of today. You read a motivational book and it's gone. You put your feet on the grass and it's gone. But it's really more complex than that. And I really appreciate that we have a clinical psychologist who's at your level to really explain what happens in the brain. Because when somebody presents with a clinical depression, for example, it's not just a feeling that they can snap out of. Can you please explain just as simply as you possibly can around what recourse somebody like that needs to take? Because there's obviously stuff that's happening at a neuro level that have got nothing to do with how somebody spoke to you or how much money you have or how much access to travel you have. So let's talk about the brain function and how it affects us and our depressive states, should we present with that.
Yes, so I'll try and simplify it as much as I can. But when a person has depression, there are structural and functional changes that take place in the brain, right? You have the hippocampus that is involved, the prefrontal cortex that is involved. You have the neurotransmitters that are involved, including the amygdala. So all of these changes now affect, because depression has to do with it's a mood, that's why we call it, it's a mood-related disorder. So there's this deep sense of sadness.
Yeah.
It's unexplainable, right? And that now affects how the person thinks, views life, how they see themselves, how they feel, and also how they will behave. And that now is not something, like you said, it's not something that they can just snap out by just doing fun activities and things like that. It's because there have been major changes in the brain. And that's why sometimes, depending on the severity of the depression, so we do classify our mental health disorders as low, moderate or severe. So usually between the moderate to severe, we would advocate for medication. We'll send them either to a GP that is well-versed in mental health or a psychiatrist for medication to help, especially with the brain function, in collaboration with psychotherapy, in order to give them a better advantage of living their life to the fullest. So it really has a huge impact. When we talk about mental health, we talk about how we think, how we feel, and how we behave. So once that changes happens in the brain, behaviors can be unpredictable. And depression is known to be the silent killer, because a person can really act normal, function, smile, help everyone, and one would never really know that they're going through something deep as going through depression. So you often get people confused when they say, oh, but I saw him yesterday, he was laughing, he was smiling, next day he committed suicide. Because they too sometimes can't explain what they're going through. People often don't understand where they say, I just feel sad. I just don't feel like doing anything. They can't explain it. And that's why the changes, apologies, the suggestions of just doing this or just doing that is not as simple as that. It's not going to account for the neurotransmittal changes that person is going through.
We're talking about the relationship between mental health, mental state, and suicidal thoughts. And we're currently in conversation with Deborah Olusola, clinical psychologist. If you have any questions for her, please drop them on our WhatsApp line +2763 406 9126. Or alternatively, comment below on our social media platforms at Channel Africa on Facebook and YouTube, and at Channel Africa 1 on TikTok. We'll continue the conversation right after this.
Africa Update on Channel Africa with Lulu Kabu.
Mozambique's opposition leader Venancio Mondlane has been charged with incitement to terrorism and disobedience. He faces a total of 5 charges. The charges relate to post-election violence that left hundreds of people dead. What punishment is he looking at?
The most severe charges are 2. One is incitement for terrorism, and also is being charged for mobilizing people for terrorism during the protests. These charges are really serious and severe. If he is condemned, is found guilty, he could serve 10 years plus years in jail, meaning that he would be banned from political participation, mainly for the 2028 and 2029 electoral cycle.
The director of CDD, the Center for Democracy and Development, Adriano Novunga.
Africa Update with Lulu Kabu, 12 to 1 p.m. Central African Time. We take no sides, none whatsoever. We are the Upside.
24 minutes after 1 p.m. Central African Time, we continue our conversation with clinical psychologist Deborah Olusola about the relationship between mental health and suicidal thoughts. Deborah, let's talk about signs. Are there any warning signs that we need to look out for? Perhaps there's a relative, a friend, a colleague that are exhibiting certain traits or certain signs that are not very common from what we've known them. Are they there? Are they evident? And what do we need to look out for?
Yes, definitely there are signs and symptoms. They are not always obvious. But we often say that if you see a change in their behavior or entirely new behavior, that may be a cause for concern. And obviously we have to take the context into consideration. So what I mean by context is to be able to ask further information if you're starting to suspect or worry. So the change in behavior, if, for example, they're starting to withdraw from family, from friends, people at work, becoming more quiet, down and out, maybe very negative, or it can even be on the other end of the spectrum, where maybe they feel quite elated, excited, happy, Sometimes that can also seem out of the norm. I mean, we've often heard about, the sudden happiness and excitement in those who've actually completed, or should I say, successfully committed suicide towards the end. Maybe if they talk about killing themselves, they're feeling hopeless, they feel like they're not loved or they're not capable of being loved. If they're drinking more alcohol than usual, maybe they're using other substances as well. If you notice that they're finding different ways to end their lives, maybe walking on the highway, maybe walking on the road where there's oncoming vehicles. If you notice that, as I've mentioned before, if their mood is much lower than usual, they're no longer engaging in activities that they used to engage in. Maybe they're making quite a lot of excuses. Maybe their performance at work is starting to decline. Now, if you notice that they're speaking more negatively, they are irritable. Some of them do sometimes get quite aggressive. It's possible, or they're quite agitated. Or you also notice that even though they've gone through a period of sadness, suddenly there's a sudden improvement out of nowhere. Sometimes, usually when they get to that point, it's because they've accepted their fate and they've decided that this is it. So those are some of the signs and symptoms that families, friends, colleagues can just take note of. Even like notes, maybe goodbye notes. If you also notice in your messages, suddenly, I don't know if you've seen those TikTok videos where men would start calling their friends and telling them good night, and then their friend would say, I'm okay. You know, it's things like that that one can consider as a sign. If it's really out of the norm, if it's not something that they usually engage in or what they normally do.
Oh, we've really got to be mindful, but I really want us to interrogate the role of modern medicine in treating mental disorders. Talk to us about its role, and also its role in suicide prevention, because a lot of times we, or at least I've witnessed, with friends and family that have been on clinical medication, that they have been able to kind of become a little bit balanced. Obviously, with what the medication is supplying, they're able to function normally, as it were. So talk to us about the role of modern medicine in treating mental disorders and its role in suicide prevention.
Yeah. So when we're talking about suicide, remember, suicide is not a diagnosis on its own. It's usually accompanied by a mental health disorder, mainly depression.
Right.
And it can also be accompanied, for example, with your psychotic disorders as well. So when we are looking at depression, we are looking at the fact that, as we've spoken earlier, there's some kind of imbalance or change in the brain. And so when medication is administered, it's to help, correct some of those imbalances. I can't say completely, but there is an attempt to correct some of those imbalances, because often with the psychiatrist, they will encourage clients or patients to continuously go through psychotherapy, because people need to learn the coping skills. You know, often people think that when they're given medication, it's a happy pill. There's a joke that we always make with our patients. They think it's a happy pill, but it's not as simple as that. It's just to help with the neural pathways and being able to engage the brain in different activities that they can do to be able to help themselves. So, for example, some of the medications that are given is to help them with their sleep patterns, because often with depressive clients, we often see a change in their sleep routines. So more often than not, we find that people are struggling, they have insomnia. So they are up for most of the night, or they have interrupted sleep. So they may be prescribed medication that helps just to restore their sleeping cycle, right? They're not put on medication for life, but it's just to get them back into a routine where they can sleep. Because if your brain doesn't shut down, it means your brain is constantly on alert, and that's going to affect your entire bodily system, your nervous system. Because we're not robots, you know. So it's like a car. If you don't put petrol, it's going to collapse. It's going to stop moving. It's going to stop working at the end of the day. So the medication helps to reduce the mental and emotional pain or load that a person will experience, right? But it has to be accompanied by the work that they do. So, for example, people have gone through trauma. People have gone through difficulties. So that may contribute to why they're feeling what they're feeling. And, you know, depending on the situation, people want to take their lives. So the medication doesn't stop the thoughts of suicide, but it tries to help elevate their mood, for example. But the real work is in psychotherapy, where now we try to understand and unpack why they feel the way that they do. What is triggering these thought patterns? Because we've seen people on medication, but they still go ahead. They even overdose on their medication.
Deborah, we're going to have to unfortunately park it there for today. Thank you so much for your insights this afternoon. Deborah Olusola, clinical psychologist, talking to us about the relationship between mental health and suicidal thoughts as it is observation of World Suicide Month, Suicide Prevention Month, rather. And it's been an important conversation to be having in Africa, as mental health can sometimes be looked at as a taboo, but we'll continue our conversations later on during the show. It's 31 minutes after 1 p.m. Central African Time. Let's get the latest in sports with Figile Lingwati.